Greetings to all viewers. Many women, whether they are adolescents or in the reproductive age, they have very painful periods, which is due to a disease called endometriosis. Quite often, it is not diagnosed on ultrasound and they get misdiagnosed. And surgery and medical treatment quite often does return, even in spite of treatment. So, a lot of them are in anxiety and they come and ask, what can I do about it? Is there a natural method for treating it? I am Dr. Shobana Mohandas, gynecologist and laparoscopic surgeon from Sun Medical Center, Thrissur. Many of these patients, even after surgery for high degree of endometriosis, they say, Doctor, how can I prevent this from happening? And for quite a long time, I was wondering what to tell them. But recently, since 2000, some studies have started coming saying that this disease can be decreased in severity or prevented from reoccurring in patients who have undergone surgery or medical treatment with diet. So, this video is about diet in endometriosis. Basically, endometriosis is a disease where the lining of the uterus jumps out from the tubes and gets settled outside the uterus here and there. And when it is in a wrong place, naturally you can expect that it will create reactions and pain. And this makes girls miss school, college, office, whatever. And they get worried about never having children, guilt about getting married, and they have severe dysmenorrhea. And when quite often it's misdiagnosed as PCOS, anything and everything is considered PCOS these days. And they continue to have their pain. And the trauma is there of dealing with an incurable disease. Will I never get cured? So all these anxieties are happening, and that helplessness. I can't do anything about it, and it's getting recurred and things like that. So we have to understand that the problem is because of endometrial tissue settling outside the uterus here and there, and that causes pain. So can we decrease the amount of tissue coming here with diet? The diagnosis is quite often by laparoscopy. On all these studies are many of them are based on laparoscopic studies, and then they redo the laparoscopy and they see that after a particular diet that lesions are decreasing in size. The crux of the problem is the inflammation that happens around the place where the blood gets settled. So the dietary pattern should be against it. Most often it is fruits and vegetables, just like many other diseases. Fruits and vegetables are the answers for most of the illnesses. So also endometriosis. Out of the fruits and vegetables, basically the citrus fruits, lemon juice, orange juice, musambi juice, they are the ones which are reducing the lesions in laparoscopically confirmed endometriosis, not because ultrasound doesn't show what it is. And in confirmed cases, they found that giving these fruits and citrus fruits helps. But cruciferous fruits are good for many other illnesses like cabbage, broccoli, uh, cauliflower. In endometriosis, it can worsen it. Therefore, when you take vegetables, be careful to avoid the cruciferous fruits, vegetables, and mostly take the citrus fruits. Again, there is a molecule called resveratrol, which can decrease the amount of lesions. That is there in peanuts, red grapes, and all the berries, strawberry, blueberry, whatever it is, all of them contain it. Again, the oil, vitamin D is necessary to remove all these lesions, which is rich in salmon, tuna, mackerel, and in dairy products. So high vitamin D can help. Another thing that can help is long chain omega 3 fatty acids. That is a good omega 3. That is again there in the same fishes that we talked of, which contain vitamin D. In addition, for vegetarians, it's there in flaxseed, chia seeds, which is not common in Kerala, but it's available. It's good for a weight reduction also. It's also good for endometriosis. Walnuts and spinach. So all these things contain a long chain omega 3 fatty acids, which can reduce endometriosis. Good old turmeric, which has been used in Indian diet since long. If you put 150 milligram per day in one glass of milk, boil it and drink it every day. It has got anti-inflammatory properties, and the pain of endometriosis can definitely reduce. And post-surgery also, for prevention of recurrence, it is said to be useful. Another thing is substituting your tea with green tea can help. Green tea is supposed to reduce endometriotic implants. Of course, caffeine per se is not known to increase endometriosis, but green tea can help in preventing it. So when you're sitting at your computer for long periods, instead of taking those frequent sips of tea, it is better if you can take frequent sips of green tea in patients with endometriosis. The licorice root and curcuma root, these are whatever you use, biryani, you have those long sticks. So those are supposed to be having properties to reduce the cells. So that can help. Licorice roots are available. That also can be powdered and used. So cinnamon, licorice roots are some two things which can help in reducing endometriotic implants or the inflammation caused by the endometriotic implants in the stomach. So the pain of endometriosis can reduce with these roots. Magnesium is something which can reduce endometriosis. And magnesium is rich in bananas, pumpkin seeds, legumes, all sorts of legumes, rajma, beans, everything has got magnesium. And walnuts, avocado, everything will have magnesium. What to avoid? Gluten-free diet is good, and for that case, rice-based preparations in South India are gluten-free and are good. But if you are really addicted to chapati, you can substitute wheat with gram flour or multigrain flour or gluten-free flours which are available in the market, and that will help. It will prevent the stickiness of the food to the intestine. Gluten is also there in bread, pasta, pizza, cakes, pastries, biscuits, crackers, and most of the gravies, the additive, to make it sticky and tasty, it contains gluten elements, and that is not good for us, for at least endometriotic patients. Something that's again not good is barley, which is not commonly eaten, but it is there in some drinks like Horlicks. The basic amount content is barley. And flavored milk and milkshakes, all of them have additives. Yogurt has got additives. Ice cream with additives, they will all have gluten. And this gluten is bad for endometriosis. Again, high consumption of trans unsaturated fat, just like many other diseases, is bad for endometriosis also. Mostly there in vanaspati and samosas and whichever uses dalda and things like that for cooking. Another thing is repeated heating and frying can lead to trans fatty acids. So more than 3 times, you're not supposed to boil it, the oil. But when you buy from a restaurant, they will keep the oil from morning to night and they'll go on frying in the same pan. And therefore, eating restaurant food is less good for you compared to homemade food, because there we have the control in our hands. After 2 or 3 times of boiling, we can throw the oil, wash the vessel, and reuse it again. Aerated drinks, energy drinks, all of them are bad for endometriosis. Anything with a lot of sugar, laddu, chocolates, whatever. Dark chocolate is actually good for endometriosis, but the sweetened portion of any other edible condiments, they are all bad for endometriosis. And high salt in all the fritters that we eat, that is also bad for endometriosis. Red meat is supposed to be, if you eat it more than once serving per week, is supposed to be bad for endometriosis. White meat like chicken is not that bad, fish is not that bad, but red meat is supposed to be containing heme, which can increase the risk of endometriosis. These are all coming from studies. Finally, sitting for long periods can increase endometriosis. So, in short, Being active and eating good food can prevent this disease or stop it from progressing. And making a change in the diet and finding interesting ways of cooking good things that is good for endometriosis, which will not increase endometriosis, can help stop this disease. I hope this video was useful for you. Thank you so much.